My name is Olivia Deschamps. I am the first author of the article entitled Acute exanthemas, a prospective study of 98 adult patients with phases of cytokinic and virologic investigation. Acute exanthemas are frequent, caused by drugs or viruses, but some remain of undetermined cause. There are no guidelines for viral investigation required in routine practice. We conducted this prospective study to better describe acute exanthemas, to focus on virologic and histological aspects, and to investigate, as a pilot study, the value of cytokinic and metagenomic analysis. We included 98 adult patients consulting in the emergency unit of the dermatology department in Henri Mondor Hospital between February and July 2014 for an acute exanthema evolving for less than 7 days. Patients benefited from standardized clinical file and examination, blood tests including virologic investigation, serologies and PCR, and 2 skin biopsies. We defined 5 groups based on clinical examination, drug history, and virological investigation. Group 1 viral, Group 2 drug-induced, Group 3 viral and drug-induced, Group 4 idiopathic, and Group 5 pityriasis rosea aspects. Skin biopsies were reviewed blind of etiological diagnosis by the same dermatopathologist. We defined 3 patterns: 1. Dermal infiltrate without changes, 2. Spongiotic reaction, 3. Interface dermatitis. Levels of 16 cytokines were quantified in the blood and the skin biopsies by using specific assay. Then technique of shotgun metagenomics was performed on available samples. Main clinical results showed that patients of Group 2 were older than those of other groups. Levels of liver enzymes were often abnormal in viral groups, whereas CRP, eosinophil rates, and fever did not differ. A virus was identified in 29 patients, HHV6, on 74% of cases. 92 biopsies were reviewed. Group 1 more frequently showed a pattern 1, no epidermal changes. Eosinophilic infiltrate was no discriminant. For cytokinic analysis, 23 couples of samples were studied. Results of blood were very low. However, results in skin samples showed in Group 1 increased level of interferon gamma and IL-1R alpha, suggesting a T helper 1 cell response in the skin. Group 4 biopsies showed increased concentration of IL-33, cytokine-induced during an immune response to cellular stress. For metagenomic analysis, 10 couples of skin and blood samples were studied. Only skin showed positive results. Interestingly, among the 4 patients of Group 1, viruses incriminated at baseline with routine virologic techniques was not found. In contrast, 2 microorganisms were found: Enterovirus A, Coxsackie in 2 cases, confirmed by throat sample, and Pseudomonas aeruginosa in 1 case. This study is the largest prospective study of acute exanthemas. It questions about the diagnosis value of routine practice viral investigation, especially HHV6 and other herpes viruses with high frequency of positivity in adult population and detection of latent DNA in PCR technique, in opposite to metagenomics that shows RNA. It confirms the lack of specific histopathologic feature. Detection of IL-33, an alarmin, can suggest an environmental trigger in idiopathic acute exanthemas. Then antiviruses should be more considered as a cause of acute exanthemas, even if the presentation is not foot-and-mouth syndrome. To date, except HIV investigation, no routine practice investigations are warranted. However, cytokine profiles and shotgun metagenomics in skin sample seem to be feasible and of interest to better investigate this exanthema.